Well, welcome back, everyone. Today we are joined by Lima Memorial pulmonologist Dr. Abdul Basit to discuss the effects of smoking on our lung health. So thanks so much for joining us, doctor.
Good morning.
All right. So firstly, can you share with us how smoking damages the lungs over time and the long-term consequences of smoking and secondhand smoke?
Okay, thank you for having me. Smoking is a toxic substance. When a patient or a person smokes, a lot of chemicals are released. The nicotine is a stimulating substance that by itself doesn't have harmful effects, but there are estimated to be 6,000 to 7,000 chemicals that are in the smoke. That includes benzene, butane, cadmium, different kind of chemicals that are vaporized and go inside the lungs. Over time, these substances are very toxic to human body. In the lungs itself, these substances start to cause inflammation. The sacs, if you think of lungs as a lot of sacs that contain air, those sacs over time get inflamed and then start to literally burst. Those sacs are gone over time. And in the tubes that take the air deep into the sacs also get affected, and that we call as chronic bronchitis or inflammation of the tubes. But equally serious or more serious is the effect of these chemicals on human body, and these are carcinogenic effects, meaning the smoke itself is not just causing inflammation, it is actually causing DNA damage at the cellular level. And over time, due to constant inflammation and DNA damage, the risk of cancer production goes very, very high.
So how does quitting smoking impact your lung health, both immediately and long term?
Yeah, so when a person or a patient in this case stops smoking, we see some effects that are immediate. You can think of it in days to weeks. For example, the carbon monoxide level starts to come down very rapidly. We also see that the taste comes back. We see that smell comes back. All of these effects are not seen within days, but over weeks and months. Patients notice that they can breathe easy, they have less cough, they have less irritation, less sinus problems. So that you can call as intermediate effects. And then we see that in about half a year to 1 year, the risk of actually getting a heart attack is cut to about 50%. And over 5 years, the risk of developing cancer is cut back to about 50%. Over 15 years, your risk equalizes to a non-smoker population. So the effects can be immediate, but some of the more serious effects may take a much longer period of time to resolve.
Yeah, and for those that are interested in quitting smoking, of course, you can talk to your primary care provider, and also just call the Lima Memorial Hospital pulmonary medicine office at the number that's going to be on the screen. It's 419-998-8295. Well, doctor, I want to say thanks for joining us today. I appreciate it.
Thank you so much.
All right, well, don't go away because we have more and we return.